Hello, I'm Dr. Gerald Lewis. This page on my site covers angina. It's important that you read through the description of angina because there are a number of ways and pains that angina can actually present itself with, and it can be a bit confusing. It's also very important that you look at the emergency steps you should take if the angina should continue without treatment, or things in fact which may suggest the angina is getting worse and you should be doing something about it because it can become serious. There are a number of treatments that doctors can do, including the various investigations and procedures such as angioplasty and stenting, which have almost become routine and probably been overused these days, and of course coronary artery bypass surgery. And these have tended to dominate discussions, but medical treatment, including aspirin, beta blockers, calcium blockers and nitrates, are still essential for most angina patients, and I'm sure almost all cardiologists will recommend that patients with angina should take a statin drug, and if you're in doubt, I suggest you read the page on statins, which is lower down on this website. There are a number of things you can do, including mild exercise, reducing stress, getting to your ideal weight, not smoking, and diet. And once again, these are discussed in more detail on this page. Unfortunately, however, diet these days don't cover the nutrients that our bodies need, and we certainly do need supplements, including a multivitamin, vitamin D, selenium, fish oils, and for patients with heart disease, calcium and magnesium. Coenzyme Q10 can be helpful, as also can be hawthorn. There are a couple of other therapies which we discuss on the page as well. One is EECP, Enhanced External Counterpulsation, which I think is very effective, especially in patients where the angina can't be controlled, and chelation therapy, which I think is more debatable. But I think it's important to remember that angina is a warning sign that the arteries are diseased and can sometimes be a prelude to a heart attack. Therefore, it must be taken seriously. And I'd recommend that you also read the web pages on preventing heart disease and also on emergency treatment. I hope this page is helpful.